Hey there everybody, my name is Dr. David St. Jean, and this video is a brief overview of adrenal fatigue. First and foremost, if you think you or a loved one is suffering from adrenal fatigue, I strongly encourage you to read some of our adrenal articles or check out our adrenal video blog if you prefer to watch things. There is a ton of content there for you that we're trying to empower you with the right information to make educated decisions about you and your loved one's health. So you learn exactly how you can begin to recover your adrenals, plus a ton more. But basically, I took the topic of adrenal fatigue and I broke it down into several conceptual categories in the hopes that it would assist you in better understanding what is actually happening with your body. We also added some really exciting new interviews with experts and delve into their advice when it comes to healing your adrenals. So check it out, definitely worth looking into. Adrenal fatigue is a complex disorder. It's characterized by a host of symptoms, which really affect almost every body system, meaning that it affects your nervous system, your gut, your hormones, your immune system. And one of the hallmark symptoms shared by most adrenal fatigue patients is profound fatigue. And usually the fatigue is not improved by sleeping all day, and it's worsened by just normal everyday amounts of physical and mental activity. Many of my patients with adrenal fatigue often function at a substantially lower level of activity than they did prior to the onset of their syndrome. And most are very aware of this. But it's really a shame because a lot of people are uneducated when it comes to this, and they look at these patients as lazy, which really couldn't be further from the truth. In many cases, adrenal fatigue persists for years or even sometimes a lifetime without proper diagnosis or treatment, which is just a shame. This is not a new condition. This has been around for a very long time. The only thing that's really changed in today's doctors' ability to identify and diagnose this condition properly is their perspective. And even those who are aware of the condition and familiar with it and know how to treat it, they often implement unnecessary and costly treatments. So I want to emphasize a very important point when it comes to adrenal fatigue in general. What I've noticed in clinical practice is more often than not, adrenal fatigue acts as more of a secondary issue instead of like a primary condition, right? Meaning, oftentimes a major problem isn't really the adrenals. Instead, the adrenals are kind of compensating for a more serious hidden underlying issue. 9 times out of 10, that issue stems in the gut. But nevertheless, it has a huge impact on our population and I think deserves attention. So if you are like most patients who stumble on our adrenal fatigue video series and articles, you've probably been searching and scouring the internet, maybe even asking friends and family for advice and making appointments with doctors and nutritionists and life coaches, etc. Maybe you've even gone as far as ordering certain types of lab tests, and potentially you've been placed on those all too familiar one-size-fits-all adrenal protocols, right? And you only end up in the same frustrating scenario, which is wasted time, wasted finances, and minimal results, if any. So when it comes to adrenal fatigue, I'm not a fan of protocols. I'm not a fan of cookie-cutter approaches like most other functional, holistic, or integrative medical practitioners. If you are undergoing an adrenal program and the main treatment involves just taking an adrenal support supplement, or you're on a specific protocol for your adrenals and you're still not feeling better, when you think about it, the state of your adrenal fatigue you're experiencing probably didn't occur because your adrenals didn't have enough of that support product, right? The more likely situation is that the actual unidentified underlying issue may not be primarily your adrenals, and instead might be associated with a different body system, like your gut, your immune system, or your detoxification system. And oftentimes, as I said before, your adrenals are compensating for something else. Doesn't mean that those treatments aren't valid. It just means that there's more to do. And that's really where my job comes in, is to figure out what is actually causing them to shut down in the first place, and then and only then help support their recovery. So if you or a loved one is suffering from adrenal fatigue, check out our video and article blogs to learn a ton more about your condition. That's really important to understand what's going on. I know you're going to enjoy it. There's a lot of information there. And again, thanks for tuning in. This is Dr. St. Jean. I'll see you next time. Take care.